Welcome back to OpenLine. Talking about medical malpractice. We have with us medical malpractice attorney Clint Kelly. A lot of calls, so let's go back to the phones. Gail, hello Gail. Gail, are you there?
Oh, yes.
Good, go right ahead.
Yes. Let me turn the TV down.
Oh, yes ma'am. That's good.
I went to my dermatologist here in Nashville, and she, I had a cancer on my hand, sun cancer. And I noticed when she came into the room, she pulled out a surgical thing, and it had a curve in it, but it was in her pocket. And she removed it, did a biopsy and removed it. Well, in about 3 days, it got infected. And I called. And I was at work. I called and I said, are you there?
Yeah, we're here.
I said, this is getting infected. The doctor, I said, could you have the doctor call me back? Doctor never called me back. Her nurse did. And she said, put Neil on it, blah, blah, blah. Well, it got infected, and I got MRSA. And I called and called. The doctor not once called me.
Okay, all right, well, let's talk about that issue.
Ben, MRSA is a big problem right now. It is a type of staph infection that is very hard to treat. There's only a handful, maybe even less than that, of antibiotics that can treat it. It can be deadly if it gets out of control. And so anytime that there is an infection, a post-operative infection, and I mean, even a dermatologist does surgery when they're removing moles or removing masses, you got to jump on an infection quick. I don't know to what extent this MRSA is spreading or causing more difficulty for Gail, but there's no excuse for a doctor not calling back. And I don't understand that. And doctors sometimes wonder, why are we getting sued all the time? This is why. Regardless of whether Gail has a case or not, this is a classic reason why people sue their doctors, is just a total lack of bedside manner. And I know so many great surgeons, Ben, who would pick up the phone and talk to Gail like that and deal with this like white on rice. But there seemed to be a small minority of doctors and surgeons who, for whatever reason, just will not communicate with their patients, either in a timely manner or at all. They get sued, and they go and they gripe about it, and they wonder why it's happening. This is Exhibit A about why something like this happens.
And when we have so many people going through the system and doctors seeing more and more people, you almost worry this is going to happen more.
Yeah, I mean, look, there's sometimes I'll have a list of people to call, and you get tired at the end of the day and your brain's not working right, but the fact of the matter is some people's lives depend on it, and if someone is calling and wants to speak to you, I mean, you're getting paid. You're getting paid for this. This isn't charity. And so when someone calls and says, I think I've got an infection, how hard is it to pick up the phone? You don't necessarily have to call back that day, but at least call back the next day and say, Gail, are you okay? What's going on? And come on in to see me.
Yeah,
I mean, how easy to say, look, come to see me at my place. I'm not going to see you at your house. But this is the #1 reason why there are lawsuits in situations where doctors gripe, is because of failure to communicate with their patient.
All right, we only have about 2 minutes left in this segment, but there's one case that is just astounding. The Joan Rivers case,
right.
And it kind of encapsulates some of the things you've been talking about.
Right.
But kind of walk us through that in about 2 minutes or so.
Okay, I keep up with this case because I'm just endlessly fascinated with the details. And every few months another little detail leaks out. It was a confidential settlement, and it was a substantial settlement. But what happened here is Miss Rivers, who was earning Ben about $3 million a year at the time, she's 81 years old and still making a great living doing shows, and in fact, she had a show on Bravo.
Right.
In any event, she went to her clinic to have an esophageal dilatation, which is they just pass a scope down and widen your esophagus, to prevent swallowing difficulties. And when she was having this procedure done at this clinic, they probably should have had it done in a hospital because of her age. but because of celebrity, they went inside to do it in the clinic. While this procedure was taking place, her doctor was taking selfies of herself with Joan Rivers sitting there in the bed. And while this was going on, Joan Rivers' vital signs tank. Heart rate goes up, blood pressure goes down. She begins to show signs and symptoms of cardiac arrest. And so by the time they recognize this and jump on it, they don't have the same life-saving equipment that a hospital has. So they have to rush her over to the hospital after trying CPR and other types of life-saving maneuvers. By the time she gets to the hospital, it's too late, and she winds up dead. And the sad part about it, other than the selfie, which makes this just totally unforgivable,
Right.
is the fact that someone who should have been thinking about her care and making sure she was all right was totally starstruck and thinking about themselves, and that was her physician. And I'll tell you how you know something really, really bad happened there. The director of the surgical clinic was fired within weeks of this. They never fire anybody during a lawsuit. So that tells you how much of a departure from the proper guidelines for care there had been by the surgical group and the doctor.
Yeah, enormous negligence. All right, we'll take a break. We'll come back, wrap everything up. Be back right after this.